Hi, welcome everybody. We're back from our break now and ready to go into our second session for today, which is on how are NGOs responding to this crisis. I think all have, wanted to sort of know what others are doing and learn from, practices that are emerging from our peers. I think this is critical, and a lot of our speakers have covered this at a time when no one person knows exactly what to do. And most of us, as we saw in the poll earlier, have possibly never even experienced a crisis in our working careers. And so what's really important then is to let the individual mindset be and sort of take this collective approach to problem solving. And so the topic on how are other NGOs responding to the crisis was something that was really coming out of that for us. We had Satwa present some interesting views on this topic yesterday. And today we have Acumen presenting some views from their fellow community. And so with that, let me start by introducing our speaker for today. Abbas Dadla is the program lead for the Acumen India Fellows program. In 2014, Abbas was selected as an Acumen India Fellow and has ever been closely involved with the 130 plus strong fellows community in India. Prior to joining Acumen, Abbas spent 5 years building Avanti, a social enterprise that combines passionate teachers, world-class curriculum, and technology to deliver high-quality math and science education in the interiors of India. With a desire to understand systemic challenges in India, Abbas subsequently moved on to education and healthcare projects with India's tribal communities and urban poor. Abbas holds a bachelor's degree in mechanical engineering from the Indian Institute of Technology, Mumbai. Thanks, Abbas, for taking this session for us. Over to you.
Awesome, thank you. Cool. So as Neha said, it's something none of us have really seen before in our generation. And as I was preparing for this, Ratish spoke yesterday and shared a few stories. And today morning he wrote a really beautiful piece on LinkedIn that talks about everything that we've been preparing for and all the hard work that we put in really is for this crisis. And it's really showtime for all of us. So we're going to do a slight shift from the earlier session and thinking about how to plan for our organizations to sort of wear the other hat that all of us are doing, and really thinking about what can we do for the communities that we are out to serve. And what we want to do at Acumen really is share a few stories from our fellows community, but through this session, not make it about us. We believe that the answers really are in the room and in all of you and in the 300 plus people who are on this call. So we're going to do a tech experiment and invite all of you to fill in a Google Sheet together. Yeah, that's going to be about 350 people simultaneously typing into a Google Sheet. And then we are going to audaciously try breaking you out into small groups to really share stories with each other. And I'm just going to set the ball rolling by sharing a few stories from myself. So from our side. So sorry for any of the tech glitches that come up, but I'm going to jump right in. Just a quick introduction to Acumen. A lot of our work, our investing work, and the fellows programs that we run really is grounded in this manifesto. Some of you might be familiar with it. In case you're not, you can watch a couple of videos on it online. But the part that I really want to talk about right now is moral imagination and how in these times of social distancing and hard financial situations and an economic crisis, we still continue to have the audacity to imagine a more fair and inclusive world post-COVID, and also have the resilience and grit and the hard-edged hope to think beyond ourselves and our organizations and really protect the communities that we're out to serve. So I just wanted to start by addressing this. A real quick introduction to Acumen. We do impact investing work, patient capital, companies that have products and services that enable the poor to transform their lives. We also run fellowships across the globe. In India, there's a fellows community of 130 plus. Some of their stories we've got today, and some of their organizations are also on this call today. But really, the common connecting force with all of them is a drive and a desire to challenge the status quo and to tackle poverty and all forms of social injustice. The third vertical is knowledge sharing. There's plus Acumen courses that you might have heard of is being rebranded as Acumen Academy, which are learning materials for all of you anywhere across the world. So with that, let's dive in. we're going to talk about 3 different kinds of stories today, and there's a few that you can see here. We're going to talk about how fellows are pivoting their models to tackle the current COVID crisis. We're going to talk about how some of the fellows are, and some of you are leveraging your assets that you currently have built to tackle COVID, and also create space for collaborative initiatives to be shared with each other. And all of you are going to be putting in what you're doing across each of these themes into this common Google Sheet that we're going to be sharing shortly. Quickly diving in, the first example I want to talk about is Suhani Mohan, an Acumen fellow who runs Subtle Designs. Some of you might have heard of her. It's a Mumbai-based startup. What they do in a nutshell, they provide access to high quality and affordable menstrual hygiene products using product design, machine technology, and innovative distribution. Just like all of us, the first thought was, okay, there's going to be a lockdown. There's going to be no revenue coming in. There's going to be all of their teams that are going to be stranded, their community health workers that have to stop operations. And in all of that, there was a question that popped up in their heads. There is also a huge shortage of masks. What can we do to help the government and help the healthcare industry and the frontline workers? Can we possibly reinvent? Can we possibly repurpose our machines to create masks? But they were already working from home. So the tech team sort of came together to see if it's possible to reorient the software and the hardware. As you see on this slide, towards the left-hand side, they've managed to do a pilot and get masks made. And you see Suhani and her co-founder there. The challenge that laid ahead of them was that they did not have the necessary tooling kits to fix their machines to create masks at scale. And Suhani made a call out to the universe, asked around, leveraged her networks, and within 8 days of reaching out to the Mahindras, as you can see on the right side, they had access to the manufacturing plants of Mahindras. There was one in Kandivli. They gave them access to their tooling materials. They've set their machines up. And as of today, the last I knew was that they could possibly manufacture 10,000 masks per day in another couple of days. Their call to action, if there's people who have access to grants on this call, is they need quick grants to be able to set up more of these machines. They've got all of it. The design is ready, access is ready. They need quick grants and they can easily churn out more than 50,000 masks a day. So that's, I think, one story of incredible hope and moral imagination. Another story is of Shruthi Pandey, an entrepreneur who runs a sustainable construction company, Structure Eco, based in Delhi. A lot of her work in Uttar Pradesh. Their focus was on harnessing the potential of agricultural residue to build structures that are cost-effective and sustainable. Similar journey. The first thought was, what do I do with my construction workers? How do I continue to pay them their daily wages to help them sustain this lockdown? Again, the same question came up. How can I be useful? And there's a huge shortage of isolation centers. There's a huge shortage of quarantine facilities, especially in shorter towns. Social distancing is a privilege. If you're huddled together, 7 people in a house, there is no concept of social distancing or physical distancing for that matter. Within a few days, she and her team designed Medicare, which is a portable makeshift medical ward that can literally be set up in a few hours to create isolation wards anywhere, anytime. She's already started coordinating with several different districts and foundations. She has access to the procurement of the raw materials. All she needs is bulk orders of about 10 or more, or I think 20, 25 together, so that she can ship these off. They've got the necessary permissions, and these can literally be set up in a few hours. Call to action: if you're in a district that needs that, and you have access to the district magistrates, the officials that can take decisions, tell them about this, look up her website, and reach out to her. Her email ID is on the slide as well. She can help set up isolation centers in a few hours. So I think these are 2 just phenomenal examples of how they, in this time of crisis, while protecting their employees and their companies, also just thought about what can be done. But not all of us have products or services that we can provide, but we definitely have different assets that can be leveraged. So I'm going to run through the rest of the examples a little quicker so that I can break you up into small groups as soon as we can. Another Acumen this is an Acumen investee. Burnett is one of India's largest vocational training providers. What they've done is they've got access to centers across India. And they've repurposed their centers to stock essential goods. They're using their workforce, they're using all safety measures. They've got the necessary permissions to deliver essential goods to stranded laborers. If you run organizations, you know of organizations, you are in touch with migrant laborers in any metropolitan tier 1 or tier 2 city that may be stranded and aren't being tapped into by existing relief measures. There's an email ID in this slide. You can reach out to them. You can look up their website. You can look up their centers and try to access their nearest center. A simple way of just using your office spaces or using your training spaces that are currently shut down. Some other examples, there's Haq Darshak and Gramvani. They're on their virtual digital platforms. Haq Darshak and Gramvani are fairly popular now, so I won't do too much of an introduction, but Haq Darshak's got a public platform that they've released a couple of days ago with all the relief measures that the government has introduced, along with schemes in 11 different languages. They've also activated a helpline in 11 different languages. Why are we showcasing some of them? One of the big questions that we've been navigating with a lot of the fellows is we've got community health workers, we've got community field workers. All of them were working on our mission. We've stopped what we are doing. But we need to continue paying them, and most donors right now are focusing on COVID relief measures. Can we train our field staff? Can we train our frontline workers using technology providers like Gramvani, Haq Darshak, etc., so that they don't have to learn everything about COVID, but they're simply the connectors between the beneficiaries that they were serving and platforms like these and helplines like these. Similarly, Gramvani has set up state-wise IVRs. They're continuously getting in audio messages from people who are stranded, and they're quickly coordinating with CBOs. If you're a community-based organization, reach out to them, get onto their platform. If you're in a nearby district, they can connect you with people who might be stranded so that you can provide relief. They're also pushing back what's not working, what schemes aren't reaching the ground to the government so that the government can act in quick measure. So these are a couple of examples of how you can leverage different assets that you have. The last thing that I want to talk about before we open up this spreadsheet for all of you to start thinking about and sharing what you all are doing is really collaborative initiatives. And I want to take a step back right now and even go back maybe to India as we knew it a few months ago. And we've seen a lot of fragmentation. We've seen a lot of divisiveness, but this crisis has made us spark everything else that was happening in the country. This crisis is literally touching every single person, and it's been inspiring to see people come together in ways that we'd never imagined. An initiative that I wanted to quickly highlight is a group of organizations. Some of these logos might be familiar to you, that actually came together a year ago, and that's why it's so fascinating that even before COVID came up, Bihar, a state in India that most of you know, has been under-resourced, has not had access to funds, talent, etc., and they've got complex challenges. This set of organizations came together knowing that they need each other to change the narrative of Bihar. No one can do it alone. Luckily, they already had a good set of trust built in. There was regular touch points and coordination, and they were able to really leverage it. To give you a couple of examples, Satyendra, who runs CSEI, has rural youth who are spread across Bihar. They've been getting requests from mainly lower caste communities, migrant laborers that are completely stranded. And all he does is shares this information with a contact number onto this group. And someone who's in that district either knows the government officials, either has access to relief funds and is able to immediately tap into those. And these exist in Mumbai, Delhi, Bangalore, etc. And all of you are part of these different initiatives. So I've spoken a lot. It's been 20 minutes of me speaking. What I'm going to do now is stop and actually give all of you space over the next 7 to 8 minutes to share along these 3 different themes, right? What are different ways in which you are pivoting your model that you can share with others? What are different ways in which you're leveraging your assets that you'd like to share with others? What are different ways in which, what are different collaborative initiatives that you're a part of that you'd like to share with others into a common Google Sheet one of you, Sneha or somebody, if you can put it in the chat. And then we'll give you 7 minutes to spend some time. But before that, I'll go and see if there's any questions that want to be addressed. I see a few people raising their hands right now. Let me just pause right now and just go to bed.
Sorry, just ignore the link I sent. I'm just going to send you the Google Doc link now.
Yeah, that would be great.
Yeah, okay, this is the one. The link I shared second starts with docs.google.com. That's the spreadsheet.
Yeah, and this is going to be an experiment. So what I would say is, get into this. If you have access to a computer, get into the sheet. Try not to fill the same field that somebody else is already filling. So there's 365 people on the call. Try to split yourselves up. Go as low as you can. Take maybe a couple of minutes to really quickly fill out the basic information about your organization, but spend most of the time filling out the 3 different themes. It's not as important for you to really fill out the right theme, but what we want is for all of you to have access to this sheet together, even beyond this call, and to find ways of adding each other to your collaborative initiatives, to find each other in the same cities that you all might be in, to get ideas of hope from each other and stuff. So I'm going to stop speaking now, and I'm going to go through the list of questions if there are any, and give you 7 minutes to fill this out on your own. And then we're going to try breaking out into small groups. If you can see my screen again, here's what you're going to see in the sheet if you can't access it right now. So maybe take a couple of minutes to even pen it down or write it in your laptop, and then you can add it to the sheet later. Think about how you've been pivoting your model, if any, and you'd like to share with others. And if there's any specific call to actions, think about what assets you're leveraging that you'd like to share with others. And if there's any collaborative initiatives you're a part of, and try to use as many keywords as you can so that it's easy for people to find them. Avoid long paragraphs because too many people may not necessarily be able to read everything. Is anybody from Mahila Saksham Foundation on the call? Would that be Aishwarya? Can you unmute Aishwarya, perhaps to share a little bit about what they're doing?
Well, my name is Aishwarya, like Abbas already said. I'm the founder of Mahila Saksham Foundation. We're a relatively new organization. What our core is to give vocational skills and development to women aged 18 to 40 and financial inclusion. However, in lieu of the pandemic, our primary project got stalled, because of which we were in a flummox, and we realized that what can we do during this time that is the need of the hour and still fight for the voiceless? Because initially our mission statement was fighting for the voiceless, which is women that come from a different strata of society. So the voiceless in this case became the daily wage laborers who now had the economic, who were suffering the most economically. And therefore we started a digital supply chain innovation model in order to help them. It's called Ration for All campaign. Now how that works is it's mainly through social media, through my network and also through a little bit of political influence, that I was able to raise a good chunk of money, around 5 lakhs, and do the logistics of it by Paytm alone. So every grocer in India has Paytm. So what we do is we collect money through Paytm from our fundraisers. We identify areas where the concentration of the migrant laborers is the most, and then find a local grocer there and send him the money so that our on-ground volunteers can then bifurcate the ration and give it to the poor migrant laborers. And therefore, this is enough for them to survive till the end of lockdown, till the end of 15th April. So 1,000 of yours means ration for 3 people till the end of lockdown. So that's the whole idea. And it's been quite successful so far. We've been able to help around 1,000 families, which is 3,000 people, and we're going for 2,000 more families. So yeah, that's what we've been doing. Yeah, thank you.
Thank you so much. Is anybody there from Katkatha? The name would be Shruthi Goel. Mary Ellen? If you could, I mean, the same thing, right? If you could take a couple of minutes to just share either one of the three themes and a call to action that you might have for everybody.
Hi. So Katkatha works on GB Road, which is a red light district in Delhi, and we work with the trafficked women and children there. So one of the response activities that we are doing is in collaboration. So we realize that we are not on ground. So I will talk about two. I will talk about the collaboration that we are doing, as well as the leveraging of assets that we are doing. So one that we did is that we've been working with this community for 6 years now. So we are very closely connected, and we know the people inside, and we have children that we've been teaching and women that we've been working with. So we quickly identified community leaders who became the face of our relief work. And we started doing WhatsApp campaigns. The community leaders started making videos of about, what are the best measures to be taken in this time. Also, we collaborated with the STM, the Delhi police, the Delhi government, lot of local NGOs. So we did a lot of utilization of existing resources which are in the system rather than raising new funds. So we did a lot of utilization of existing resources, and then we pumped in more funds from our existing funders, donor base. And right now, today, as we speak, we are distributing individual kits to each woman, child, man, and infant, which has food, which has hygiene supplies, which has even Cerelac baby powder. So I think community leaders and collaborations really helped us do an impactful relief work at this point of time. And I would just say a call to action to everybody would just to try doing hyper collaboration in your local networks and reach out to people and create a network, because we don't know how long this will last, but we will be able to ride through if we do this together.
Thank you, Shruthi. We may have time for one or two more people. Can I get Sachi Maniar from Ashiana? Is she online?
Hello, can you hear me? Yes. Can you hear me?
Yep, Sachi, go ahead.
Okay, great. So we work with at-risk youth in government-run childcare institutions, mainly 2 institutions in Mumbai, and also all the children who are in the community. We basically got panic calls once the lockdown happened, and so we organized our volunteer base and the children to meet and do circles, restorative circles and peacemaking circles on Zoom, something that we never thought children could use or were not digitally savvy. Also, within the institution right now, there is out of a 70 people staff, about 15 of them are on ground. So kind of a lot of support is being provided in terms of supplying masks and, just filling up forms for them and things like that. But the rest of them are home. We're kind of training them in circle work so that when they hit the ground running. Some amount of work is being done in what happens when this lockdown opens up. So we're trying to think of livelihood projects and things like that for when the lockdown opens up. And in terms of funding, we've kind of dipped into our own savings, and at the same time putting up a fundraiser pretty soon to support. And we, for individual support of children who need food and basic necessities, we tied up 1 donor to 1 child so that they can take care of it for the next 3 months. So we've just kind of partnered volunteers and children so that they can support individually. And just collaborating with UNICEF in many ways to try to see if we can pool in all resources, and also volunteers are putting in a database together of videos and things like that for government homes to use it when their homes are Wi-Fi connected, to engage the children who are locked up in their institutions and facilities. So that's us. Thank you so much.
Thanks, Sachi. Marilyn, can we get Anantika Singh from Hindustan Unilever Foundation, who could also sort of share a very different perspective with all of us?
Hi everyone, this is Anantika Singh from Hindustan Unilever Foundation. So a couple of things that we began to do, because as soon as this broke out, we started to get a lot of requests from our partner organizations on, just support and talking about migrants who were back on their way back to the villages, stuck in different locations. And we work primarily with rural agrarian communities. That work a lot on creating water conservation infrastructure through NREGA. So the lockdown has really impacted, work there, so much so that there are, people needed immediate support just to kind of get by to, tide over the lockdown period. And one of the quick things we did is, how about we repurpose unspent funds that still exist on live programs. So it's also the year end for us. We can kind of do a quick review, see what's possible to repurpose from just a continuity perspective to allow the communities to tide over this period. I think that was one big thing. The other thing is we've also gotten a flurry of requests from organizations. We've got requests to partner on several forums such as this one. We're also conducting a quick rapid assessment. I mean, we're using technology. Again, a lot of our on-ground partners are already working within government systems. So they have created task forces of their own at the village level to, begin to figure out how do we now prepare for the influx of labor once this lockdown is lifted. And for us to understand what is meaningful support at a time like this, we also needed to get a quick sense of what's happening on the ground. So we're rolling out a rapid assessment survey, as we speak. Like today, in some of our UP locations, we're going to do similar surveys in Orissa, a lot of our program areas, just to get a sense of what's the immediate need, and how can we then leverage our network of partners, both community organizations from a delivery point of view and donor organizations from a collaborating resources point of view, and address the needs that are actually emerging from the ground through the rapid assessment. So those are some of the things that we've done so far.
Thanks. There's also, I also see the Nudge Foundation that's also working across various systems. Is Sakshi around? Sakshi Jain from the Nudge Foundation. Maybe can you share a little around how all of us can come together in different ways and different collaborative initiatives?
Sure. Yeah. Thank you so much. So at the Nudge, we do a bunch of different things. At the Nudge, one of the main things that we work on is livelihoods. And what we've done now is that our mobilization team, which earlier worked on mobilizing youth from rural backgrounds, they're now, doing an outreach and talking to people about, just spreading awareness based on the guidelines by the Ministry of Health on how to cope with the crisis, on staying at home, etc. The other larger thing that we're doing is we work very closely with Give India, and Give India has set up a fund. If you guys would, I can share the link here as well, to help daily wage workers' families as well as families in need of daily ration, to just sort of give them direct benefit transfers or transfers of ration. So, yeah.
Thank you. Let's take one last person. Can you get Manjula from Muktangana? And then I'll sort of wrap this up. Thank you, Emmy.
Hi everyone,
yes, Manjula,
how are you? How are you? Hi.
All okay, Manjula.
Okay. Yeah. At Muktangan, we are into education. Currently, what we are doing is we are connecting through our teachers, and the teacher educators are connecting with the parents and the children from home through phone calls, Zoom calls, so that the children and the parents are engaged. We are now thinking about social emotional status of the children because of this crisis situation. Everybody is like emotionally affected. We are trying to hear them out any problem that they have got socio-emotionally, try to engage children, because during this time children are really like they don't understand. We ourselves have not understood, so children have not understood the situation. We are trying to engage them through parents, create an environment there at the home. Parallelly, if they need any help, like during the crisis, most of them are daily workers. If they need any help, through our sources, we are supporting them. This is what we are doing. We are trying to cater to the socio-emotional part and education part.
Thank you.
Yeah.
Thank you.
Thank you so much. Yeah.
Thank you. Thank you, Manjula. I'm going to pull back my presentation. I'm just going to try screen sharing that. Just give me a second. Yeah, this is up. Full screen. So what we did over the last 10 minutes, thank you everyone for hanging in with us, was what was going to happen in small groups, where there's going to be groups of about 7 to 8 people, and each person sort of taking 2 minutes, but really using the sheet as the starting block so that you can go back to the sheet and go back to the person and you can engage with them. That can still happen outside of this space and outside of this conference as well. So we're gonna organize the sheet up, and as people start signing out of the sheet, others can access the sheet and add their own information and keep updating something new that you're doing. You can add links to it that could be easy call to actions for people to get redirected to your website and stuff, and also add contact numbers that might be quick for people to sort of like just pick up the phone, given how quickly and rapidly we need to act. I'm going to just piece together a few learnings from just sitting on the sidelines and really watching our fellows on the field, right? That maybe might help us even both to fight COVID and in the long term. I think a lot of us are, even the reason that we are seeing so many people sign up and just so many spaces being created is because there's a lot of, it's overwhelming. It feels like there's a lot to be done simultaneously. And I've had many moments of just sitting by myself in my room, not knowing what to do. We run a leadership program. My customer is no longer the same. My beneficiary is no longer the same. Their organizations might shut down. What does leadership even mean today? And I can't do everything that I want to do with them. Similarly, you may not be able to do every single thing that you want to do for your communities. But I think it's super important that you are clear on what your assets are and what role you can play, so that you don't overwhelm yourself trying to do every single thing. I think, and a lot of the other speakers have already spoken about, build for nimbleness. We don't know what might happen a week from now. The number of cases are almost doubling every 4 days, etc. Everything we've talked about today might be redundant 2 weeks from now. So build for agility for the next 6 months. And I think that's just a core skill set that all of us will emerge with. It's a time to seek connections and collaborations. This sheet, the COVID collaborative resource, there's so many different circles there. You can reach out to us and we can keep connecting you with any fellow across any sector and city. This is not something any of us will be able to do alone. A lot of us are reinventing the wheel in many ways. A lot of us are duplicating the same effort. So before you start doing something, try to see if somebody else is already doing that and find ways to collaborate. It would have been completely futile if Acumen had tried setting up something independently and Atma had tried setting up something independently. It's just great that we were able to just call each other and say, hey, in 3 days, we're setting this up. Can we join forces? And I think this crisis has taught us that it's just important to follow and not try doing everything, and not also try designing or leading every time. So I think these are just something that we've seen from our fellows, and I've tried to make it as simple and lucid and practical that may help all of us take this together, because we are all in this together. That's my 1 hour with all of you. Thank you so much for having me here, sharing a few stories from the fellows, trying a few experiments that hopefully you can try again. Some worked, some didn't. That's how it is. Over to you at Atma.
Thank you so much, Abbas, for that enlightening and definitely, sort of unique mix in the sessions we've had over these 2 days. So let me go ahead and try and summarize what to me were some of the key takeaways from the session that you took for us. I think, what stood out for me right early on was when you talked about pivoting of models, and Saral's story in terms of being able to repurpose what they do, to, sort of attend to the COVID crisis more responsibly. I think what was inspiring was that Suhani, she just reconfigured hardware, right? And for me, that's a sign of hope to say that can we actually reconfigure the way we work as teams and people, and is that probably easier or maybe in some ways even harder than what she did, right? But I think that onus is on us to sort of reflect and assess whether that's something we can do. You went on to then talk about how some organizations are leveraging the assets they currently have, trying to be responsive to COVID, right? So Haq Darshak and Gramvani both have established themselves in the past as organizations working closely with communities. I think what they have emerged in doing really well in the last few weeks is to really respond to the needs of that community. We all have been hearing and seeing how migrant workers and day laborers are probably the worst affected at this point. And I think both these organizations have created really simple communication material that can go in local languages to communities, and be able to use their strength to support their sort of end beneficiary. And I think that's really inspiring. The third sort of theme you had, an example you shared, was around the Bihar Development Collective, and how I think for me the key takeaway from that really was that collaboration for those organizations started much ahead of COVID, right? And I think what enabled them to do in a time like this was actually use that as a foundation of, right? Starting to think about collaboration even now isn't late. But I think the lesson there for me was that thinking about it early, it just helps you to sort of bolster your efforts in times of crises. So really inspiring example there. I think we then went into, sort of sharing with each other. We tried the breakout rooms, but we also used the Google Sheets. And I really like that some of you were able to come forward and, very crisply summarize what you're doing. The Google Sheet is still open and available. So if you haven't been able to write your story there, please just go ahead and do it anytime during the day. We'll collate it all and make sure we share it back with you, right? And then lastly, Abbas, you closed for us by presenting some of these common learnings that we can take away from all of these organizations. And I think that was a great way to sort of, end the session, and touch upon the notes that we have been hearing from our speakers through this conference, right? So thank you so much for taking that session. I think we're finished.